lack of energy, maybe some negative self-talk or limiting beliefs or imposter syndrome just got in your way. Through the use of hypnotherapy, you can be in a position to achieve your personal and your professional goals with more clarity, calm, and confidence. And I personally have had well over 2 decades of experience as a hypnotherapist and also as a coach for people in business, and as a business owner myself for also over 2 decades. I truly understand the power of mindset and how our subconscious minds can work behind the scenes to keep us stuck, right? It creates those weeds that keep coming up over and over again. We have to keep mowing down, and hypnotherapy can help us to find that root cause, pull that out, fill it with something that's going to serve and support us better, and help us move forward and have that peace and joy and clarity, calm and confidence that we are looking for. So today I want to go over some myths and misconceptions, and I'm going to answer my most frequently asked questions about hypnotherapy, because there are quite a few. So let's dive right in and answer some of these questions. So the first question that I get is, what types of issues can be helped with hypnotherapy? And there are actually several. There are so many types of challenges that hypnotherapy can help with. And let's start with some of the big ones: anxiety, stress, also fears and phobias of all different kinds. We have so many different kinds of fears and phobias that we can think of, from things like claustrophobia to fear of flying, fear of snakes, all sorts, right? Health anxieties are another big one that I see a lot. Social anxieties. There's so many places, right, that these anxieties and fears and phobias can come from, and hypnotherapy can be amazing for all of those. Also, hypnotherapy is incredible for reducing the symptoms of chronic health issues that can be exacerbated by stress. You know, we're whole individuals, and our physical health and our mental health are very, very much connected. And so we could have these health conditions that can cause anxiety. And of course, anxiety and stress can also exacerbate the symptoms of things such as migraines, chronic pain, so maybe back pain, things like IBS, fibromyalgia, MS, vertigo, also pregnancy, childbirth, postpartum issues. So lots of different kinds of health conditions that hypnotherapy can help alleviate the symptoms of. Also, you may have heard a lot about the use of hypnosis in changing habits. So that's something that's very traditionally used in addition to the chronic pain, you know, and acute pain even, because when hypnotherapy first came on the scene with, for example, the American Medical Association, right, there was a lot of use in dentistry, or think about pre-anesthesia. People would use hypnosis for surgeries, or if someone has, let's say, sensitivities or allergies to different medications. So hypnosis can be very useful in those cases. But when we talk about changing habits as well, think about things like emotional eating, overspending, gambling, substance abuse, things like smoking, drinking, so tobacco, marijuana, drug use, things of that nature. Also, self-confidence and self-esteem issues. Really incredible for that, as well as hypnotherapy can provide a very safe space to heal from things like trauma, to do inner child healing. I am certified in many different areas, including working with people who have PTSD, in hypnotic regression therapy, and finding those root causes that can sometimes be found in childhood. Okay, also, things like parts therapy. So if you are conflicted, right, if there's one side of you who really wants to reach this goal, and there's another side of you that is resisting that effort and really fighting back on that, hypnosis can be incredible for that as well in hypnotherapy. So, second question. Question number 2, is hypnotherapy like what you see on TV? Because most of us have really only been exposed to the use of hypnosis on television, or let's say at the fair, right, a stage hypnotist. And so the answer is no. Hypnotherapy is not the same as what you see on TV or in stage hypnotists work. So hypnotherapists do not put people in a trance state for entertainment purposes. Right? It is night and day from that when we're talking about hypnotherapy. Hypnotherapy is a type or modality of psychotherapy. And so hypnotherapists like me, and I became a hypnotherapist way back in 2001 when I was in school for clinical psychology. It was one of the modalities that I chose when I was in training to become a therapist. And hypnotherapists like me work with clients to help them overcome their challenges, where they are to help, to guide, and to help clients move towards healing. And as a registered hypnotherapist in my state, I follow legal and ethical guidelines and privacy laws. I'm clinically trained with hundreds of hours of professional training and certifications and thousands of hours of experience with clients as well. And so it's very different than what you're going to see, I said, on television or on stage. It is private and it follows all of the guidelines that any counselor or therapist would follow. So, question number 3. Is being hypnotized like being asleep? Am I unconscious? So to answer this, let's go back to the base of the word hypnosis, which is hypnos, which means sleep in ancient Greek. Hypnosis is not the same as sleep. It's not being unconscious. Hypnosis is a completely natural state of consciousness that we go in and out of throughout the day, such as when you're first waking up. So think about that. You're waking up and your eyes are still closed, but you can sense and hear everything around you. You're just in that process. So it can kind of feel like that. Also think about when you drive home from work, let's say from work or from the store, and it's a route that you've taken 100 or thousands of times, and you get home safely even though you feel like you maybe zoned out or you were thinking about something else while you were driving. You're accessing some of those similar mechanisms that happen in hypnosis. Or I want you to think about how you would feel if you've ever done a guided meditation. I always think of it as, guided meditations with deeper work, right? So that deeper state. Or those last 5 minutes of yoga class when your instructor has you lay down on your mat, close your eyes, focus on your breathing, be present in your body, and your eyes are closed, but you're still aware of your surroundings, right? You're aware of where the other people are, where the instructor is. You can always sense if they're standing there, if they're walking around the room, right? You have that sense of awareness. And so it can be similar to those feelings. It can just in a space where we can do the deeper work, where you actually have an even more heightened sense of awareness than we normally have. So you can think of it that way. Now, going along with that question, the next one is hypnotherapy giving up control? So no, you will not be giving up control in hypnotherapy. A hypnotherapist guide is a helping role, right? We're guiding, we're helping. It's not manipulation and it's not control. Not telling anyone how to think, how to feel, how to act at all. All of those answers are coming from within you. And hypnosis actually enhances your own self-control rather than taking it away from you. You will always in hypnotherapy be in control of your thoughts and your actions. You can choose what you want to share and what you don't. You can choose to stop at any time. And if the fire alarm goes off, you can jump up and run. You can open your eyes and see normally at any time. And it's so important to realize that you are the boss here, right? You're the one that's in the lead. I'm just guiding you to tap into your subconscious and your inner wisdom. I'm not going to be doing or saying anything that is out of alignment with who you are and your values and your beliefs. Now, next question. Does hypnotherapy work on everyone? What if I've tried other things in the past without success? So many of my clients have come to me after trying lots of different therapies, in different techniques, reading lots of books, including sometimes other hypnotherapy or other forms of therapies in the past. And it's actually a myth that there are a big segment of people who can't be hypnotized. Everyone has access to the levels of consciousness of hypnosis to varying depths, and everybody can benefit. The most important factors that I see are the client's willingness to make the desired changes, and then finding a hypnotherapist that they feel really comfortable with and that they trust. And those are key. I personally use a very client-centered approach, which means I have many tools available to me, and I fit the technique to the client rather than trying to fit the client into one technique. So for example, not everyone is visual. And so visualization techniques will only work for some people some of the time, but not all people all of the time. I personally am not a visual person. I'm more auditory and kinesthetic. And so I get to know my clients so that I can fit the technique to the individual client and what's going to work best for them. Whereas sometimes I've had clients come to me and say, maybe they weren't visual, and so someone tried to use all visualization techniques on them, and they had a lot of challenges with that. And there's a reason why. So, I really meet my clients where they are and deal with what presents for them in the moment as an individual. What are their strengths? What are their natural abilities? And again, fitting in, like I mentioned, with what are their beliefs? What are their thoughts, right? What are their feelings? So I'm meeting my clients with who and where they are and what their values are and their belief systems are to help them deal with what presents in the moment for them as an individual. Okay, so again, it's not about telling someone how to think or how to feel or how to act and giving them suggestions, for example, that are not their own words or doesn't fit with their own values or their own beliefs or what they want to work on. I am using their language, and I'm making sure that I am dealing with whatever is presenting for them in that moment, which means a much higher success rate than having a rigid, inflexible plan and having one technique that I would think would work for every single person. I don't believe that. I believe that one technique will work for some people some of the time, but not, like as mentioned earlier, all people all of the time. And so it's really important to me to give my clients tools and resources, including things like breathing techniques, relaxation techniques, self-hypnosis techniques, somatic release techniques, things that they can use in between sessions and after our sessions to continue providing them with benefits and empowering them to continue our work in the way that is going to work best for them. Now, on this vein of talking about not having to give up control at all in hypnotherapy and whether it's going to work for everyone, I also sometimes get asked if hypnotherapy is religious or non-religious, or how is it going to fit in with my beliefs and my values. And so just like I had mentioned a moment ago, it's so important to know that when working with me specifically, I can attest to the fact that I am not going to place my personal beliefs on anyone else. And so I meet my clients where they are. It is not against any religious beliefs. It is sometimes very much an enhancement to affirm your own beliefs to help you get more connected with your inner self, with your higher self, with your higher power, and it's based on your belief system. So I wanted to make sure that I mentioned that it is absolutely going to be affirming for you and getting you closer to and building your relationship with who you are and what you believe. Now, the next question that I get quite often is about me working virtually, because I do. And so does hypnotherapy work virtually versus in person? And the good news is that I do not have to be in person with you. I don't do any work where I touch people. And so as long as I can see and hear you and you can hear me, working virtually is just as effective as it is in person. I have been working virtually now for several years, even pre-COVID, and I have found that a client being in their own comfortable environment can actually help reduce a level of stress and anxiety of being in an unfamiliar office, having to fight traffic and take extra time away from work and home life. And so I find that it actually can help you ease in faster to the process of hypnotherapy and of working with me as a hypnotherapist. Hypnotherapy can also work virtually on pretty much all ages. And so it's really just such a wonderful technique to be able to use when we are like this, when we're using our technology, and with my ability to be able to work with people not just in my state, but also all over the country, all over the US, as well as all over the world. It helps me to be able to guide and support so many more people than I would be able to when I was working just in person. So I hope that today this helped you to overcome some of those common myths and misconceptions about hypnotherapy. I would be happy to answer any more questions that you have, so please feel free to leave them in the comments for me, or feel free to reach out to me and message me directly. You can also book a free 30-minute consultation with me. I call it that an explore call, to explore your options for support, and we can answer those questions, have a discussion one-on-one over a virtual call. So have an amazing rest of your day, and I will look forward to connecting with you all soon. Take care.